Hi everyone, and welcome back to another episode for Clinic Scripts podcast. I'm your host Stacy, and I lead the marketing team here and have the pleasure of speaking with thought leaders at the intersection of mental health education and technology. And today, I'm really excited to be joined by a guest whose work spans continents and disciplines. Yushin Li is the director of the Pan American International Culture and Educational Founders, whose best-selling authors in Taiwan and a passionate advocate for integrating mental wellness into global education. Yushin, welcome to the show. Let's dive right in. So you've worked extensively across North American and Asian on mental health and cultural education. So, what have been some of the biggest challenges you've faced when trying to communicate mental health conception across, the different cultural systems? And do you think AI can help bridge some of those documentary or communication gaps?
Oh, first of all, thank you for having me. And yes, definitely. So I think that one of the major cultural challenges I face is how mental health is practiced and perceived across countries. So for example, in Canada, it's common to see therapists using a laptop for note-taking during sessions of conducting therapy virtually. But in contrast, in Taiwan, many therapists still prefer handwritten note and avoid taking notes during the session to maintain a sense of presence and respect. So there are also difference in preference for one-on-one therapy versus group-based approach, but which can reflect different cultural values and around privacy, community, and emotional expression. So I believe AI can help bridge those gaps by offering adaptive tools that accommodate cultural preference, such as switching between real-time and post-session note-taking or translating therapy model across cultures in a respectful and tailored way.
Well, I really like your insight. So, your foundation is now exploring AI-driven education. So that's really exciting and very timely. So, I'd love to hear in your experience. So, what's the most promising way AI can support student well-being and mental resilience, especially in a learning environment?
So our exploration into AI-driven education is rooted in personalization and accessibility. So we hope to use AI to better understand each student's individual's need and recommend curriculum paths that support not just academic growth, but also emotional and psychological development for each student. But more importantly, we're looking into how AI can help students, especially those from rural or under-resourced areas, connect with our wider learning community. So we want students to feel seen, supported, and accompanied, regardless of their physical distance. They can all be seen. So in that sense, AI becomes more than just a tool. It becomes a bridge.
Because I have already hosted a lot of episodes. So, what I learned is in therapy, one challenge we often hear from the professionals is how difficult it is to keep consistent with emotional documentation or track subtle changes in clients' progress. So, do you think AI has the potential to assist with this kind of emotional tracking or like a reflective journaling, particularly in educational or like the youth focused programs?
Yes, I can absolutely. So I see AI as a new generation companion, both for individuals seeking support and for professional managing cares. So for therapists, AI could help analyzing large volume of qualitative data, like session notes or journal entries, to detect patterns and subtle change in emotional state. So this could allow for earlier intervention or more tailored care. And at the same time, for individual, AI could offer a sense of presence and emotional support in moments where professional help isn't immediately accessible. So it's not just about replacing a therapist, but enhancing their ability to care through smarter insights and continuous support. That's what I thought.
Yes, let's talk about your book. So I actually read like some pages of your book, and it's been widely read and has clearly resonated with so many. So if you were to expand that messages through an like the AI driven platform like a mental health companion app or an interactive self-guided program, so what elements would you want to preserve most to keep it authentic?
That's something I've thought deeply about. So my book was written to feel personal, like a quiet conversation between me and my reader. So if it were to be digitalized or to integrate it into an AI platform, I would want to retain that feeling of empathy and trust. So my vision is to allow each reader to interact with the book dynamically. So perhaps answering questions and exploring reflective exercise, or even receiving customized prompt based on their emotional state. So with the right design, AI could help transform the book into a living companion, consulting and responding to reader in a way that is deeply personal, yet rooted in the original message. So that's what I really thought it could become real in one day.
Really lovely. And well, the last question. So I know that you work in such a global, cross-cultural context. So one concern, like the many therapists and educators have is whether AI can truly understand or respect culture sensitivity. So based on your experience, how do you think AI tools should be designed to ensure like they are culturally competent and emotionally safe?
So I truly believe it can. So while AI may not replicate human emotion, its strength lies in processing massive volume of culture and behavioral data. So with the right training, it can learn to respect nuance, like the difference between silence in an Eastern context versus a Western one. So, or how different cultures express vulnerability. So sometimes people don't need advice. They just want to be heard. So if AI could offer that space with respect and sensitivity, it can play a meaningful role in the global mental health support.
Thank you so much, Yushin. Thank you so much for joining us and for sharing your wisdom, because your work is such an inspiration. And I know our audience will take away so much from today's conversation. So, to our listeners, if you like to learn more about Yushin's foundation or her book, we will have those links in the description. And you can also follow us and to hear from different voice from different therapists and psychiatrists and psychologists. Until next time, stay well and stay curious. Thank you so much. Bye.